Welcome back to another episode of Black Facts. Today, I'd like to welcome Dr. Harris. She's been practicing physician in women's health as a gynecologist for over 32 years, 17 of those specializing in bioidentical hormone replacement. She currently has her own private practice, Nurturing You Women's Health and Wellness, Inc., which serves both women and men. Welcome. I'm so happy to have you on this episode talking about women's reproductive health.
Well, thank you so much for having me. Hey, we go back a long time, so
Yes.
I really appreciate you inviting me to be able to share with your guests today. So thank you so much, Michelle.
Oh, absolutely. So I wanted to kind of talk about this because oftentimes, as you know, we as women, we're busy, we're taking care of everybody else in our family. We make sure that they go and get their health taken care of. But I've been finding out recently that, not only friends and family members, but just women that I hear about in the news, especially women of color, we have not been taking care of ourselves, our own health, because we're being diagnosed with late stage diseases, and that's making our survival rate a lot lower than those of our white counterparts. And I just wanted to talk to you about how we can do things better and what we should know about our own reproductive health. So I want to start by asking you, even if you don't plan on having children, why is it important for women to take care of their reproductive health?
Well, like you said, it is reproductive health, yes, to reproduce. However, our bodies are what I call our temples, and it is imperative for us to be able to be mindful of every aspect of our well-being, actually from the top of our head to the soles of our feet. But since we are talking about women and reproductive health, looking at the structure, let's just say when we talk about reproductive, what really are we speaking about? So we're really talking about internal organs, which are comprised of uterus. Okay, the opening of the uterus is the cervix. The hormone producing aspect is our ovaries, but we also produce hormones from other organs in our body, such as the adrenal glands. There's even a gastrointestinal tract that produces hormones, etc. And then, of course, as we kind of come out of the uterus and in through the cervix, then we get to the vaginal canal. And the vaginal canal then has what we see on the external part, which is, the labia and other parts of our external anatomy. So again, reproductive is internal as well as external. So yes, it is for reproduction. However, our hormones are with us all of our lives. From the time that we go through puberty, our sex hormones are there. And they can affect so many different aspects of our health and our wellness. So, as you shared, I'm someone who specializes in bioidentical hormone replacement, meaning that I take care of women, all age groups, but I also specialize in women who are in their, what we call the perimenopausal or right before menopause, women that deal with PMS, people that go into menopause, and then even postmenopausally. So it can affect us in so many ways. And I don't want to get too deep into that, but believe me, our whole well-being is centered around hormones. Okay. Our well-being, how we function, everything. So it's important for us to be mindful of these changes that we go through and be able to seek someone who's going to take care of us in a way that's being mindful of us as women and what we value. Okay. So, but anatomically, our uterus, even though that is a place of where children, our babies are born, it is also the place where we can get a lot of different problems. I think the most common thing that we know about, especially in the African-American community, is fibroid tumors.
Yes.
Although they can happen in any, Caucasian, Hispanic, everyone, it's very prevalent. And a lot of times I find it happening earlier in younger women. Many times it's genetic. So the women in the families, like the mom and the aunties and the sisters, have problems with fibroids. So, thinking about what fibroids are, it's benign tumors that grow in the muscle of the uterus. And if you're not mindful of, say, your menstrual cycle, and you're not taking time to look at what is the pattern of my cycle, is it monthly? Is it getting heavier? Is it getting more cramping? Am I passing more blood clots? Things like that. You may not be aware that things are changing. Something could be developing there, like a fibroid tumor or a polyp inside of our uterus that can cause all of these heavy bleeding problems. When bleeding is heavy and excessive, it can cause us to become very anemic. So you're talking about, I'm tired, I'm fatigued, I got headaches. What's going on with your menstrual cycle? Are you bleeding heavily? Why are you bleeding heavily? People may not realize that thyroid problems can cause heavy bleeding, abnormal bleeding patterns, etc. People get polycystic ovaries. I know I'm saying a lot, but when we're talking about our bodies, I mean, it's so much involved with our reproductive organs. Polycystic ovaries is when there's abnormalities in our hormones. Again, your period starts skipping. And some people say, hey, yeah, I only got a period like once every 6 months, but that's not okay. You need to get that checked to make sure that there's not some other reason for why that is happening. So again, being mindful of like our menstrual cycle pattern, the amount of flow, etc. If you're not mindful of these different things that our body is going through, you're not going to seek attention and then be able to find out, oh, this is not just happening just because it's happening. It's happening because there's some other underlying cause. There's a reason that this is happening. There's some other medical condition that may need to be addressed before you keep going down a path and have a real serious problem that's there. So,
okay. No, I appreciate you kind of sharing that. You actually answered why it's important for women to take care of the reproductive health, because by taking care of your reproductive health, you can find out some other, potential underlying problems and catch it early and get it addressed if you're focusing on your reproductive health and not just for bearing children. You mentioned something about, getting checked out. So when is a good time to start getting gynecological checkups, and how often should we get them?
So currently, let me go back a few years. So years and years ago, we used to do Pap smears, which is a cervical cancer screening tool. Okay. So this was in order to detect cervical cancer, but really more to detect precancerous changes on our cervix so that you can do something before it does get to cancer. So years ago, all we were able to do is look at abnormal cells and then treat abnormal cells. Now we have other things that we can test at the same time. We can test for HPV or human papillomavirus, which is known to be the cause. There's like over 100 different strains of HPV, but there are some strains.
I have to ask you this clarification. So is that an STD?
Yeah. Yes. Okay. Yeah. So human papillomavirus, yes, is a sexually transmitted virus. Okay. So there's over 100 different strains. Some of the strains cause genital warts. Some of the strains cause abnormal cells on the cervix, such as dysplasia. They call it dysplasia or abnormal. But then there's some strains that cause cervical cancer. So like you shared, this is something that is a sexually transmitted virus. So again, years ago, we had to just look for cells becoming abnormal. So people had to get their Pap smears every year. But with the introduction of us being able to screen and test for HPV, now we can kind of separate people out into the high risk versus low risk. Okay. So say we do a Pap smear, your cells are normal, the HPV is negative, your monogamous relationship, for sure there's a monogamous relationship on both sides. Okay? You're considered to be low risk. So for women, like say over 30, you can have right now the current screening guideline says 5 years. I'm kind of like a 3 to 5 year person. Okay. And that's provided everything is normal. Okay. So if your HPV is positive though, or if there's any abnormal cells on your Pap smear, then you do have to follow up in another year. Okay, so and of course, we're talking about mildly abnormal cells. Then you have to do it every year. So, but I also tell people that there's more to a gynecologic exam than just doing a Pap smear, right? So You know, if everything is perfectly okay, I still say make sure you come in every 1 to 2 years, because we're doing more than just looking and testing your cervix for cervical cancer. We're doing your breast exam. You know, we're doing a pelvic exam, meaning we're palpating and feeling your uterus and making sure that there's nothing going on with your ovaries. Looking on the outside, there may be things going on the outside, the labia. You know, you could have lesions there. So there's more to a GYN wellness exam than just the Pap smear. The Pap smear is a specific test to test for cervical cancer. But again, we want to make sure we're checking everything out. When I do my wellness exams for our women as well, you know, you may get blood tests too to get screening, you know, for certain types of things. People are walking around with thyroid problems and high cholesterol and vitamin D deficiency and B12 deficiency, and they're pre-diabetic and they don't even know. You have to go in to get tested in order to find out what's going on. So my recommendation, you know, every 1 to 2 years, that's provided everything is normal. Do your
are we starting out when we start our cycle or when we turn 18?
Actually, the current is right now 21 for Pap smears. To start.
Okay. Wow. Okay.
21 for Paps. However, if someone is sexually active before then, or maybe like, oh, I'm getting ready to go away to college, and you know, and you want to have that time to talk about, you know, what may happen, and so that way a young woman can be prepared. You know, so it's also a time to start to having those conversations about protecting yourself from getting sexually transmitted infections or from getting pregnant or whatever. It's time to do those things before you actually get a Pap smear done. So even before 21.
Okay. So you were talking about coming in and get your screenings. So should that include, if say, okay, I'm 21 and I'm going in to get my Pap smear test, should I get a breast exam at that same time, or is that involved? You know, is that like the comprehensive procedure when I go in, or should that start happening earlier?
No, and for me, I do breast exams even from when they come in and they having their Pap smears. If it's 21 years old, I still do that because there are some even benign breast tumors that can happen in young women. So, you know, and it's also an opportunity to educate them and show them how to do a breast exam. You know, it's also taking an opportunity to say, okay, do you know how to do this? Okay, well, this is, you know, we show them how to do that. So that way, when they're out of your presence, you know, they at least know, oh, okay, this is what I need to be doing. So yes, I do breast exams. And of course, you know, sometimes women, they only go to a gynecologist. They may not go to like a regular primary care doctor. So that's also an opportunity for me to, you know, do examination, make sure there is no thyroid nodules, listen to their heart, make sure there's no irregular rhythms or anything like that, or murmurs, listen to their lungs, do an abdominal exam. So, you know, it's again, in many cases, although I'm a specialist, so I still can be like a first door of opportunity for someone to start getting an examination beyond their pediatrician years. You see.
Okay, I wanted to circle back because you were talking about HPV. So I know that there is a vaccination that they're promoting for our youth to get, you know, the HPV vaccination. Can you talk a little bit about that and why that's so heavily promoted, and what are the potential benefits to getting that, you know, early on before you're even sexually active?
Even sexually active, exactly. So, you know, remember we were talking about like the HPV. So it's a virus. It's a sexually transmitted, but it is a virus, meaning so they were able to develop a vaccine that essentially will give you what you need so that in case you are exposed to one of the high risk strains of human papillomavirus, your body has antibodies to fight that off. So it's basically preventing it from being able to infect you. So just the same way as other vaccines work, you know, we get vaccinated, you know, against whatever, you know, chicken pox or other things. So works the same way. I don't like to get too complicated with it, but it works the same way. You're vaccinated, you're preventing, you're building up your system so that way in case at the time of sexual activity that you happen to get exposed to one of these high risk strains, your body is able to fight it off, if you will. And it's not going to be something that, will cause a problem. And it actually has been successful in reducing cervical cancer, as well as even some of the other pre-cancerous changes as well. So it kind of cross covers. Although it's made of the antibodies towards the higher risk ones, it still can cover some of the lower risk ones as well, and thus reduce, incidence of cervical cancer. So,
are there any other type of vaccinations that can help with women's reproductive wellness? I guess
I don't know about them. Most of the other ones are other infectious type things, but not necessarily, I would say, vaccine.
Okay.
These are more like things with the primary care doctors, like hepatitis and, which is one. Hepatitis is something else that you can get a vaccine for, and making sure. But most of the time, young people in a country are able to get a lot of these things during like their school years and things like that. So. Mm-hmm.
How important it is for women to track their menstrual cycle?
Well, as we were sharing a little bit earlier, there's underlying conditions that can manifest themselves by irregular periods, like skipping cycles or having heavy cycles or having prolonged cycles and things like that. There can be underlying things. So it's not just to make sure that you're not pregnant, it's also to make sure that there's nothing else that might be developing that could be an underlying problem that's causing you to either skip or have it too often, or have it long, or have it short, or heavy, light, that type of thing. So,
what questions should we be asking our gynecologists when we go in to have our appointments?
Well, I think that, a GYN visit is so diverse depending on the age group, So a GYN visit for, like we were saying, a young girl that might be, between 16 and 18 years old, who's just starting this whole, life of potentially becoming sexually active, is very different from, young woman that's in her 20s, or a woman in her 30s versus 40 versus 50. So I think that it really just depends on where you are in your years, as far as your health and things like that. But I do feel that women need to be very proactive and not feel inhibited to ask questions.
Okay.
You're there because you are seeking help. And it's not one of those things where you feel like, okay, well, maybe I shouldn't ask, or maybe or whatever. And I will also say that ask questions, ask whatever it is that's troubling you, concerning you, whatever it might be. Don't feel shy about it. Don't feel like you're inhibited and you shouldn't ask. I mean, just ask, and speaking of that, go prepared. Okay. Because sometimes we have a lot of thoughts and questions and things like that. But then when we're sitting there in the office, it's like, you
forget. You get nervous and you forget.
You get nervous and you forget. So it's very important to write things down. So that way, when you do go in for your visit, whatever concern that you may have, you actually have it written out. So that way you can go over, with your physician. So again, it just really just depends. I want to say that there's some blanket statements that everyone should ask. It really just depends on where they are in their reproductive year, where they are in their life, what kinds of things there are, but making sure that you feel free enough to ask questions. And if you feel like you're not getting answers, go somewhere else and ask questions, because physicians are here to help. We're here to serve our patients, and people have to remember that, we're here to help you. We're here to serve you. We're here to make sure that all of your concerns are addressed. And if we can't personally do it, then we need to find someone that can and refer you if that's needed.
Now, are there any closing thoughts that you'd like to leave with us? Is there anything that, as a GYN, that you'd like to tell us that we need to do other than come prepared, be willing to be open and ask, ask
Mhm,
questions and
mhm.
have that, open relationship with your
Sure.
GYNs so you can make sure that that your health is, that you're getting your health needs addressed?
Absolutely. I think that I would have to say that it's important for you to find somebody that you feel comfortable with. So, and I know sometimes that's hard. Okay, because when you're talking about going to a gynecologist, it's a very private, you know, area and very personal area of our life and of our health. And so you have to be able to feel comfortable with whomever you're with, and that's important. And if you don't feel comfortable, then you, again, there's a lot of us out there, you know, you have to keep on seeking until you find somebody that you feel really comfortable with, because it's a rapport, you know, we're back and forth, we're wanting to make you feel comfortable and feel open, and again, help and address whatever concerns that you have. So and don't feel shy. We're talking about gynecology, you know, there's no such thing as, you know, TMI. No, give me the information, you know, give it to me. Let me know. I can't help you if you don't tell me. And I think sometimes people feel a little shy about like talking about sexual health.
Mhm.
And it's like, that's what I do. That's what I do, you know, all day. So tell
Right.
me about, I have no libido. I could care less. I can help you about that. Let me know if you have pain when you have intercourse. Let me know if there's something else that might be going on. And you know, just there's no such thing as TMI when it comes to talking with your gynecologist. You know, that's what we're here for. And find somebody that you can feel comfortable just being open and free to talk, and knowing that they're listening to your concerns and addressing your concerns as well.
Thank you, Dr. Lita. I've really enjoyed
Mhm.
speaking with you, and you have shared so much rich information that I think is going to be very beneficial to our viewing audience,
Mhm.
especially around just being willing to come and have an open and honest conversation, because this is a very, private area we don't run around talking about, but
Mhm.
you do need to find someone, a provider that you do feel safe with, that you can be open and honest with, because it could mean you having good health or not.
That's right. That's
So
right.
I
I like
appreciate you
this.
coming and sharing information with us about women's reproductive health and how important it is for us to
Mhm.
take care of our health. I've really enjoyed this time with you. So I
Likewise,
just want to
likewise.
thank
Thank
you
you so
again.
much.
And I'll probably have you back because I want to ask you some other questions as it
Mhm.
relates just to women's health in general. But
Sure.
thank you so much for spending this
Absolutely.
time. Thank you, Dr. Lita, for joining me and explaining the importance of us taking care of our reproductive health. And thank you for tuning in. Please like, share, and subscribe so you can stay up to date on new upcoming episodes. And join me next time for another engaging conversation so we can know the facts.